Dzień dobry. Witam Państwa.
Good afternoon, ladies and gentlemen.
Będę miał przyjemność mówić
I will have the pleasure to tackle the issue of how we perceive
zaburzenia tej równowagi online,
the problem of imbalance between offline and online from the perspective of psychotherapists.
czyli jakby nawiązując do wystąpienia pani Bogny,
So with regard to Bogna's presentation, I will do my best to explain why some families, not only of teenagers, but generally families, are not able to use advice and knowledge and valuable prophylaxis material
do którego mają dostęp, który
to
często
which they have full access, which they understand and they find reasonable. However, they're still not able to implement that in practice. I will talk about the importance of a relationship in the family and family bonds. I wanted Professor Wojciech tackled the issue from the perspective of psychotherapy, and I think that this issue is not, and the potential is not fully tapped during this conference. I think that all specialists working with teenagers and children, you interact with their parents and you need to take into account the broader family context.
o tym, jak to przywracanie równowagi
I will talk about restoring the balance in the families with teenagers who are internet addicts.
poradni, którą reprezentuje Młodzieżowa Poradnia
I represent teenagers mental health center, and we're dealing with the youth
nie tylko spełniającą
who is intensely addicted,
szkody dla życia i funkcjonowania społecznego są bardzo wyraźne.
and the detriment to their social lives are important. They are paralyzing their lives and the lives of their families.
Na początek powiem króciutko o badaniach w tym temacie.
Let me quote some research.
Takim głównym i najbardziej wyrazistym w różnych badaniach te odnośniki takie
You can see some bullet points with a reference to literature, to some screening research and examination.
jest to,
So the main conclusion resulting from the research is number one, so positive relationship between the parent and the child is a factor protecting protecting them from developing problems and addiction to gaming.
granie wystąpi. I co ciekawe, szczególnie dotyczy to relacji ojciec.
And that is especially related to the relationship between fathers and children. When it comes to protective factors, including the positive perception of family life, warm relationship in the family, and close relationship between the parent and the child. When it comes to predictors of such problems,
Struktura rodziny, czy różne zakłócenia w ramach struktury rodziny, w ramach
you can expect that from families with poorer structure, with the conflict between family members, and some internal place between family members.
To nasilenie próbowego używania mediów interaktywnych wiąże też z niską
So intensive use of such media is related to poorer family relationship. When it comes to cohesion of a family, from our therapeutic experience, we learn that too much of, and if the bond is too close, that is a context for gaming addictions and heavy use of media.
Czynniki ryzyka problemowego grania, mniej czasu.
The risk factors: less time spent with families, with parents, less emotions, hostility from the side of parents, and poorer quality of parenthood.
Mogą być ucieczką, służyć jako
Playing the games can be a shelter
pacjenta.
from difficult family relationship. And here I would like to present as an example one of my patients who heavily abused social media.
Całe noce spędzać
He could spend all nights
w mediach społecznościowych,
online on different fora and in the social media, texting with numerous people.
z konsekwencjami dla
That was related to some severe consequences to his life. He didn't cope with his school obligations.
jego sytuacja rodzinna wyglądała tak, że
His family situation was specific. His father was addicted to alcohol for many years,
stosował przemoc wobec matki tego
and
ten chłopak często
there were acts of violence against his mothers from the side of his father.
wieczorami pełnił rolę
That happened in the evenings, and the kid had to mediate between the parents. After a dispute,
do komputera,
he told me that he switched on his computer to find somebody to talk to and to calm down.
do takiego problemu nałogowego używania
Apart from addiction to media, because these pieces of research, these are this is correlation research, but they present some premises, and based on our experience, we know that we can think about it as a circular system. So deterioration of family relationship creates the environment in which problematic use of electronic media is present, and if it occurs, it deteriorates the family relationship.
no to wiadomo, że jednym z objawów uzależnień behawioralnych proponowanym przez
So one of the Griffith's emanation of addiction is conflict inside the family.
i potem jakby to koło przyczynowo-skutkowe
So this is a vicious circle.
się nakręca.
The problem is becoming even more serious.
W czasie terapii staramy się jakoś
During the therapy, we're trying to put a stick in this wheel or to slow down the process and to decelerate it or
to też z badań zdrowie psychiczne rodziców
reverse the direction.
to jest
So let me quote another research on parents of kids abusing media. Sometimes it is related to a moderate or severe depression of a parent,
grania w gry internetowe.
which ends up in abuse of online games. Let me talk about the general role of parents and their impact on the balance between online and offline life for their children. It is also related to extensive consumption of sweets. This is the role of parents to teach self-control through setting limits and boundaries,
Mentalizowanie dzieci, czyli
but also through mentalizing their children, so joining their mental and psychological situation,
rozumienia
showing their understanding of what they feel.
To również wspiera regulację emocji, ale również
That helps to regulate emotions and increase the level of self-control.
zachowań.
Another role is behavior modeling.
Do późnej adolescencji potrzebują wsparcia w używaniu
Until
i to jest
adolescence, children need boundaries
tych mediów.
when it comes to the use of screens.
Społecznościowe,
Social media and games can be a source of addiction.
no tak, to takie najważniejsze, wciągające.
So these are the most captivating activities.
Seriali, filmów,
Also watching TV series and pornography.
ale to, że adolescenci potrzebują wsparcia, to też jakby jest związane z neurobiologią.
The adolescence needs support because of their natural processes. The front cortex is responsible for regulation of impulses and self-control. This part of the brain develops until the third decade of our life. Also, young adults, they do not have this part of brain fully developed.
Młodzi ludzie pozostają nadal zależni od swoich rodziców.
Young people are still dependent on their parents.
Rodzice pozostają w tej sytuacji możliwości wpływu na to, co robią dzieci. Nie zawsze wiedzą, jak
Parents can impact the behavior of their children. Sometimes they don't feel that impact, but they have it.
bezpieczne więzi rodzinne sprzyjają samemu
Safe family bonds foster self-regulation among the members of the family, especially children, and it has been confirmed by numerous research.
regulacji emocji. Jeżeli chodzi o rodziców dzieci
When it comes to
używających
parents of children addicted to media,
te dzieci potrzebują szczególnego wsparcia.
these children require support in order to regulate their natural mechanisms.
Zdecydowana postawa rodziców jest często kluczowa w tym, żeby
So a parent needs to take a firm position,
tą pomocą jest obejmowana
because if we get in contact with the child, we take care of entire family.
ci rodzice stoją przed wyzwaniem radzenia sobie z tym silnym konfliktem
The parents need to deal with heavy conflict when it comes to the use of electronic devices and technology. So there are some acts of violence in the family.
Dziękuję. Rosły nastolatek, któremu matka
A young adult or adolescence, and the mother can even beat the mother who decided to switch off the computer.
zdesperowany ojciec
Or a desperate father starts fighting with their son.
te konflikty mogą być naprawdę mocno
So the conflicts
nasilone i same
can be deep and they become problem themselves.
regulowanie własnych emocji.
So self-control and regulations of your own emotions as a parent is also of high importance.
Teraz powiem o takich specyficznych
Let me say a few words about quite specific deficits and problems
nadużywających.
of parents of addicted children.
Albo nie mają wiedzy na temat konstruktywnych
They're lacking knowledge about constructive principles and limitations with regard to the use of electronic media. If they decide to implement, to set some rules, they are not able to get through the first symptoms.
daje objawy ustawienne analogiczne do tych, z którymi mamy do czynienia w uzależnieniach chemicznych.
They are similar to the situation when you stop taking some toxic substances.
Rodzica to jest, oni mówią, on leży.
So this period of withdrawal symptoms is especially difficult. So when the kid is just laying on their bed and staring at the ceiling, the level of uncertainty is rising and they start to withdraw from the rules they had set before.
Those parents are also helpless in terms of monitoring activity and also limiting access of children to media. They don't have the skill to strengthen strengthen the child's position in case of small progress. Sometimes the therapist says to parents that the problem has been tackled, that there is progress, and parents, quoting the same facts which are available to the therapist, they say nothing has changed and that the kid is still hopeless. And finally, a very important issue. They have a negative attitude, which I'm going to discuss again soon, a negative attitude towards games. But there is also a lack of coherence from the parents concerning the use of electronic media, usually taking the form that mothers are more worried by this use of electronic media. They say that it's a disaster, it's terrible, that the child is moving in a wrong direction, that it certainly will be bad. And the fathers say, well, no, it's not so bad, don't label him as crazy. And it's very difficult for these parents to build a common attitude in upbringing their children, which is necessary to build an environment for upbringing which will be strong enough to confront the addiction mechanisms. Specific features of parents of children who are addicted to internet games. First, they have difficulty understanding that their children should be educated about internet games and using screens. They rather assume that children know everything, they know it better than I do, so what should I explain to them? And the second thing is that frequently parents had an allowing attitude at earlier stages of development, and suddenly when they notice that the child is wholly captured by those games or media, by this topic in general, then those games and media have become enemy number one, and there is a strong criticism of gaming. The parents start to forbid playing, and they become authoritarian in their attitude. So you can imagine it makes the problem of playing the games worse. It's a result which is repetitive in research. And I must say that therapeutical recommendations and education are not sufficient here, because parents are incapable of using them, because they either remain passive or they become too authoritarian, becoming a factor aggravating the problem. Some difficulties which make it even more difficult to tackle the problem, both on the side of parents and children. We have a few families at our center where every person is not neurotypical, where we have a child with Asperger's syndrome. It's not a diagnosis used now, it's rather autism spectrum. But Asperger's, the father has Asperger's, the mother who has recently diagnosed herself with ADHD, and siblings who are also not neurotypical. And you can imagine how difficult it is in such case to restore balance of building communication and rapport, not optimum upbringing style, difficulties in communicating within the family, taking too much care of the children, and to sometimes taking an oppressive form. When the mother wants the child to stop playing, they consequently still bring food to the place where they play, so that they eat something at least, because they don't eat anything while playing. Aggression occurring, I've already discussed that. Another important issue I'd like to mention is that there is a strong anxiety and fear of separation and moving to the next phase of family life. In the adolescent period, in case of teenagers, there's stress associated in the family with the fact that we will stop being a family that we used to be so far, that the home will be empty, or there will be fewer of us because somebody is going to move out. And here sometimes this abuse of media is, or maybe a form of separating oneself from the family, but also pseudo-separating from the family, which actually deepens the dependency. It doesn't build independence and being able to take care of oneself, but it deepens the dependency. Also, from the systemic point of view, we can look at using the media as having an important function in the family. I won't go deeper in this topic because it's quite complicated, but similar to other symptoms or disorders such as anorexia or depression, have this a function of which the family is not aware. Two functions: it's stabilization, protecting the status quo of a family, protecting the family, for example, from some important change, or stimulating change in the family, because the current situation has become unbearable, and the family is stuck in it. They cannot move forward. Then the symptom can move the family. So here, in our therapeutical work, we often ask the questions of the functions of symptoms. What would happen? What bad things would happen to the family if the problem disappeared? I know I'm out of time already, but let me just say about the most important thing from this point of view, because much of I've written here is in obvious reference to those obstacles I discussed before. What I want to emphasize is that we should look at activity as play, asking people what the young people play online, what role they play, if they have an avatar, who is this avatar? In case of younger children, we have the space of playing where their basic needs, conflicts, and development issues are reflected. In older children, it's the space of using the internet. When we are sometimes wondering at our clinic what is the problem psychologically of the patient, we look at what this child does online, and very often we find clear guidelines to understand their needs there online. And here, referring to some presentations at this conference, sticking to clear and obvious principles of using the media. These principles are more effective if you agree them with children. Second point, monitoring and supervision of the teenagers' activity online is important, but it's not important in itself, but it's important in association with the parents engaging in developing the family relationships with the child and building a more informed and constructive aptitude for upbringing, which should shift towards a democratic style or authoritative style. And if everything goes well, we enter a loop which is reducing the problem, allowing to regain the online-offline balance, forms of work which are useful here, parenthood consulting, family therapy, very often pair therapy of the parents, but also often we refer parents to individual psychotherapy and workshops of parenting skills. Thank you very much.
Dziękuję serdecznie.
Thank you very much. I can see that with every topic we go deeper into the problem. We have more and more to say. The time is pressing. Questions, perhaps? One question from the floor. Would somebody like to ask something or give us a comment? If not, then I believe the email that Wojciech shared with us a second again. Since there are no questions from the floor, please let me thank you for the presentation and comment what you said in the last part about asking children and recognizing what needs these activities meet. It was discussed yesterday a few times, and I'm wondering if it could result in therapy, in searching for, in seeking to satisfy those needs elsewhere. Yes. Yes, indeed. Online activity could be compared to activity in fantasy. So the characters you impersonate give you a huge range of options from which you can choose, and choosing a particular character, in my understanding, is determined by subconscious needs, and it's worth, not only in case of children, but also in case of parents, to talk about it and wonder why the child is playing this and not that, and how else we can satisfy their needs, or what should the parents be made sensitive of. I have a question concerning how long such support of a family with such problems takes, with problems of abusing screens. Just an estimation from the first consulting meeting with you of the parents and the child. Are we rather speaking of a few meetings, or is it a therapy that will take a few or perhaps more than a dozen months? That depends on the level of the problem and of the disorder in the family. But statistically, if a family is generally healthy, and, for example, this media abuse occurred in reaction to some clear stress or a specific crisis situation within the family, then a few meetings can be sufficient. But if we need to face many years of chronic pathology in the family, and that associated with disorders of individual members of that family, then this therapy could last well over a year, or even years sometimes. I'd like to ask, if I may, whether the risk of children's of the non-normative children with Asperger's, is there a bigger risk of being addicted in case of these children? Is there any research concerning this? And perhaps I won't sound professional, but are there any specific therapies for this group of children. Yes, indeed, the autism spectrum disorders are listed as the most common coexisting disorders with addiction to media. We experience this a lot at our clinic because we have really a lot of those patients with Asperger's syndrome among our patients, if not a majority. I haven't heard of any specific therapeutical programs for this group of patients. Well, yes, because I have a dilemma, because I'm a psychologist, I work at a school a few hours, and many programs purchased for children with autism spectrum are computer software using technology, and at the same time I get questions whether this therapeutical method supports or is detrimental for children who abuse the screens and technology at home, subjecting them to therapy in the same formula, in the same form. I can't answer this question. I think that would require some research. So it seems like there's somebody else who could answer this question. I'm returning back to Victoria Dantley and electronic stress syndrome, where she says that as a psychiatrist she has more and more patients who have all syndromes from the autism spectrum or ADHD, but if they are diagnosed well, it turns out that they don't have those normal standard factors, and at some point what Wojciech mentioned worked. So that is excessive, very intense, long-term contact with screens, which have influenced their development of a child which otherwise would be healthy. This problem occurred, and in this situation, Victoria Dantley said that any contact with the screen damages the effects, and there are few therapeutical tools to differentiate electronic stress syndrome from a real disorder with a large biochemical or biological component. Thank you again.